Hey everyone out there in ASG-Kuwait EMS, we're diving deep into something pretty important today. An update on magnesium sulfate.
Right. Yeah. And it's specifically about the new stock that you guys are going to be receiving. It's a little different from what you're used to.
It is, you're going to have to change up how you approach it just slightly. So this is, as always, in addition to your current protocols,
hmm
it doesn't replace anything. This is just a new way to handle magnesium. So let's get right into it.
Okay, so the update is, well, it's basically a stock refresh, right?
Yeah.
Because the old magnesium supply has expired.
It is.
The main change is that the previous magnesium that you were using came pre-mixed in bags, all ready to go.
Yeah, those are nice, convenient.
Yeah. This new batch, though, it doesn't come pre-mixed.
Nope.
It requires a quick mixing step before you can administer it.
It does. All right, so this new stuff is coming in vials.
Exactly.
And this is critical. You cannot administer directly from these vials.
Absolutely not. No.
Mixing is an absolute must.
Yes, mixing is a must. Okay, so each of your trucks out in the field, you're going to be receiving 2 vials per truck.
Okay, 2 vials.
Inside each vial, you'll find 1 gram of 50% magnesium sulfate.
1 gram per vial. 2 vials total.
2 grams total of magnesium sulfate.
So first step, obviously grab those 2 vials.
Yeah.
You're going to drop the entire contents of both of them.
That's right. So you're going to end up with 2 grams of magnesium sulfate.
Exactly. And then you're going to take that 2 grams and inject it into, what is it?
A 100 milliliter bag of 0.9% sodium chloride.
Okay, yeah. Your standard saline bag.
Yep. Your regular saline bag, you all know it. And once you mix that up, you'll have a final concentration of 20 milligrams per milliliter,
Okay.
ready for IVA or IO administration.
All right, so basically what you're saying is it's the same stuff, same concentration,
Yeah.
same amount. It's just not pre-mixed.
Exactly.
So you just got to mix it up yourselves before you can give it.
Yeah. Now, I know a lot of you guys are probably thinking, okay, well, we're used to just grabbing a bag and going.
Right. Easy peasy.
Yeah. This mixing step, it's obviously going to have an impact on how quickly you can get the magnesium to your patient, especially when time is critical.
Absolutely. Time is of the essence in a lot of these situations.
Right. Now, the good news is the actual indications for magnesium and the dosages themselves, they haven't changed at all.
Yeah, you're still following your normal protocols for when and how much to give.
Yeah.
It's just the preparation that's a little bit different now.
All right, let's take a look at polymorphic tachycardia. The dose is still 2 grams IV, and you can repeat that if needed. Now, in a cardiac arrest situation, you want to infuse that rapidly. Ideally, you're looking at getting that in over 1 to 2 minutes.
That's fast.
It is fast. And the memo, it correctly points out that because of this mixing step, you're not going to be able to achieve that 1 to 2 minute time frame.
Right.
It's going to take a little bit longer, even with the fastest flow rate.
Okay, that makes sense. You got to mix it first. Exactly.
So it's going to take a little extra time.
Right. And for patients with a pulse who have polymorphic tachycardia, you're looking at an infusion over 5 to 60 minutes. So you get a wider window there, and the mixing step won't have as big of an impact.
Yeah, so you've got a little more leeway in those cases. But let's talk about severe respiratory distress. What about those situations?
Yeah, for severe respiratory distress, the dose is still 2 grams IV or IO over 10 to 20 minutes.
Okay, so same dosage, same time frame. Just got to remember to factor in that little bit of mixing time beforehand.
Absolutely.
All right, and what about eclampsia?
With eclampsia, the dose is still 2 grams IV or IO, and you want to give that over 2 to 3 minutes, and you can repeat if necessary.
Okay, 2 to 3 minutes for eclampsia. Same as before. Just keep in mind that initial mixing step means it won't be quite as instantaneous as it might have been with those premixed bags.
Exactly. All right, so just to recap, the key thing to remember is this new magnesium sulfate, it requires that initial mixing step.
It does. It's just something new you got to get used to. Right. It's a procedural change, and it will slightly affect your preparation time, which in turn will affect the start of your infusion.
Right, especially in those really time-sensitive situations where you need to get that magnesium in there quickly.
Exactly.
All right, so as always, this new mixing requirement, it's in addition to your existing protocols. The reasons you give magnesium and the amounts you give, those haven't changed.
Nope, not at all. It's just the preparation that's different.
Just the preparation. Now, the memo mentions that if you have any questions, about this new magnesium stock or about the mixing procedure, you should reach out to your captains for clarification.
Absolutely. Your captains are your go-to resource for any questions you might have.
They got all the answers. So as you're thinking about this new process, just consider this. How will this practical change, this extra
Hmm.
little step you have to take to prepare the magnesium, how might that affect your team's response time in those critical moments where every second counts?
That's a good question.
I think it's worth discussing with your team, just to make sure everyone's on the same page and you get a smooth process in place.
Yeah, definitely something to think about.
All right, well, that's about it for our magnesium sulfate deep dive today. Stay safe out there, and as always, thanks for listening.
Thanks, everyone.